Hello, everyone, and welcome back to another exciting episode on the show. I'm so happy to have you guys here. And once again, today we have really special guests. You guys know this podcast is designed to help you to start thinking differently and take control of your life. Our guest today is RJ. RJ, our guest today is RJ Kedziora.
Yes.
RJ, welcome to the show.
Thanks for having me. Looking forward to the conversation.
All right, so our guest today brings a combination of 25 plus years in software, digital health, AI and machine language, healthcare, data, and technology leadership. So, RJ, I would also like you to introduce yourself to my audience.
Yeah, absolutely. My name is RJ Kedziora. I'm co-founder of a company called Estenda Solutions that's focused on building digital health solutions over the years, predominantly focused on what I think of as the patient health and wellness side of things. We don't do anything with billing. And we've been doing this for about 23 years now. And, I sat down a couple years back and was saying, what else can I do? How else can I help people? I get to develop systems and do that every day in my life. And so I examined what I thought made me successful. And out of that came the book called Productive Harmony, which launched a couple months ago. It's available out on Amazon. And the key idea around it is that there's only so many hours in the day. Time management has failed us. It doesn't work effectively. And we really need to think about energy management and how we use our energy to get stuff done without burning out.
Okay, so for those who are new to this concept, what is energy management?
So your brain is only 2% of your body, but it actually uses 20% of the energy that you use throughout the day. So as you might have a job and you're sitting at a desk or working on a paper, doing your homework, and you get done and you sit there and think, why am I tired? I didn't do anything. I didn't run around the block. I didn't go for a bike ride. Why am I tired? And it's simply because the act of thinking and making decisions uses energy. So much of what we do in the 21st century in a digital world is focused on the idea of being able to think well and make good decisions, and that requires energy. So it all starts with eating well, moving more, being active, and getting a good amount of rest such that you can make those good decisions with a high level of energy.
Okay,
I think
so thank you so much. Uh, you started working with computers at, let's say, about the late 1980s, right?
yes.
What first attracted you to technology and what has kept you in the field for more than 25 years?
Yeah, I was fortunate, lucky when I was in late grade school, sixth, seventh grade, that I had a personal computer, an early personal computer at home, and got to play that. And then when I went into high school, they had a computer lab there, so I was exposed to computers and technology, the idea of software development very early on. And I was always fascinated by what you could do with a computer. I played a lot of games, really enjoyed playing various different computer games. But it was also what could I do with the computer? And so even at that very early age, I was doing various things of drawing graphics on the computer and creating my own games. And that led me to a degree in computer science in the early 90s. And then that's where everything took off for me as the internet became more of a thing. The world around us really turned to digital. How can we use the power of the computer to make a difference, to be more efficient, to be more effective? And I started Estenda in 2003, and we really focused on digital health. There's a lot of technology in healthcare, but it's the last industry to really embrace the idea of data. And what was fascinating early on in the 2000s, this was before the iPhone existed, before Facebook or Instagram existed, you know, we had to figure out how to make decisions with a limited amount of data. And fast forward 20 years now, there's so much data out there that, it's sometimes people struggle, how to make decisions with so much data. You imagine going to your doctor with all sorts of health metrics, from your Aura Ring, your Apple Watch, and, they're not trained to look at that data and information. But, from the perspective of productive harmony and what I think about it is the world hasn't kept up. Time management and the idea of how to be productive just hasn't kept up with the times. As I was researching the book, I came along a story of a guy named Frederick Taylor in the early 1900s. He was the person that really kicked off the idea of modern day time management. It's called Taylorism. And he was hired by a company called Bethlehem Steel to make the workers at Bethlehem Steel more efficient, more effective. So I actually sat there with like a timer and figured out how to minimize movements and how to make them more effective. And he really kicked off this whole modern day movement of time management. But what everybody forgets is that he was fired from that job because he did not improve employee productivity. In fact, he was burning people out trying to optimize so much. And so fast forward today now, it's like the idea that we need to optimize and use every minute of our time to be productive is actually counterproductive. I call it the time management death spiral. As you might become more efficient at a task, it leads you to want to do yet another thing. And we are even seeing that now with AI in various different areas, these large language models, they're allowing you to be more efficient. We see it, within Estenda and software development. They're seeing it in healthcare across many industries. Yes, it can make you more productive, but then a lot of people are then going, oh, I can do more. And you're just reinforcing that time management death spiral, and which leads to burnout. So you really want to take a step back and be like, yes, it could be making me more efficient, more effective, but you do have to rest to be able to, take advantage of that improved efficiency.
All right. So, RG, you talk about your book during your introduction. So, what can readers expect from your book? Also, what is the title once again?
Yeah, it's called Productive Harmony. It's available on Amazon. And it's about how to be productive in the 21st century, where so much is about getting stuff done related to, just the pure act of thinking. I'm an active triathlete. I just did a triathlon this past weekend. And that's where the idea came from. I do a lot of training early in the morning, and then I can't burn myself out from that training perspective, and because then I need to be productive all day. So it's how do I balance my energy use throughout the day? And I'm always very careful of, you don't have to be a triathlete. It's just the idea of getting up and walking around will make you more productive. If you're sitting there thinking on a challenge, trying to figure out how to solve it, get up, walk away from the desk, go for a walk, disconnect. Don't use your phone. Don't start, scanning social media. That is also not an effective strategy. In fact, as I was writing the book, I came across the idea that just having your smartphone in the room with you, you're not even looking at it, but you're trying to get work done and have the smartphone in the room with you, it reduces your productivity because it's a distractor. You're sitting there going, what am I missing out? Particularly if it starts buzzing and you feel like you're missing notification. What are you missing out? So I got in the habit, when I could, to actually move my smartphone into a different room, and allowed me to concentrate so much more effectively.
Okay. Thank you so much, RG. I just wanted you to lay a little bit about your book. So, moving on, for someone who hears generative AI everywhere but doesn't really understand what it is, What actually is it, and why is it important to healthcare?
The generative AI or large language models are fascinating because it's effectively the simplest explanation of it is it's doing next word prediction. It's looking at your prompt, what you're asking it. So you ask it a question, it's looking at that prompt and it's predicting what the best response to that is. And it literally does that, word by word, sentence by sentence, paragraph by paragraph. In The technology has improved and there's more to it than that, but at the very simplest level, it's doing next word prediction. So, in fact, as the scientists created this technology, it surprised them. They were amazed by what this simple behavior was able to create. If you look at it today, AI has more knowledge, more than the average person. I can't do math at a PhD level. I can't do science at a PhD level. But the AI can do a lot of these tasks at an extreme level beyond what the average person can do. In healthcare, it becomes particularly interesting because we are human. And that's the key to all of this. We are human. We cannot retain the amount of information and knowledge that an AI system can. There's more and more data that's generated every day. We as humans get tired. We make mistakes. There's all sorts of statistics of hundreds of thousands of medical mistakes made every year. I saw a recent report that talked about the average physician to make a complex medical diagnosis is only 73% accurate. Do you want to go to your doctor and with only 73% chance of being accurate? So the combination of an AI and a doctor can make a much better experience, can improve our healthcare all around. Here in the US, one of the biggest use cases already for AI in healthcare is the idea of ambient listening. And that's just when the AI, the technology, is listening and takes the notes for that appointment. If you used Google, Zoom, any, sort of chat feature, you can see that where it's automatically taking notes. My wife is a registered nurse, and she's works in a practice that has this technology, and they have realized good examples of where it has done this transcription, particularly even between languages, where the healthcare providers did know Spanish, but not at an expert level. And in conversing with that patient, the note-taking capability of the AI caught something that the physician didn't, and was able to follow up with that patient and ask additional questions to come, to the right, decision. But there's all sorts of challenges in healthcare today, just diagnosing conditions. My mother-in-law many years ago had lupus. It takes 7 years to diagnose lupus on average because it's a very complex condition. Well, with the use of AI, hopefully we can decrease the time it takes to diagnose that condition and many others and get the care that individuals need.
Okay, thank you so much, RJ. I hope I was able to, me and my listeners can pick up something from there. So, from your experience leading software teams, what actually makes developers productive and what commonly gets in their way?
To make them productive, it's having the right tools helps. AI is starting to make a big impact in that, but understanding the user's experience, understanding who you are developing for. Now, as a software developer, you're not developing for yourself for the most part. You're developing for someone else. As we work in healthcare, we're developing systems that doctors, nurses, other medical professionals are using, or a patient, to analyze data, to view recommendations. How can they improve their health and wellness? You're not developing the system for yourself. And I think understanding that and having empathy for the end user's experience helps you be a much better, more productive developer, because there are high-level decisions that have to be made in software, but also every day as you're figuring out what fields to be put on a screen and what order to put those fields on the screen, how to organize them. They're minor decisions, but they make a big impact and they add up. So the more you can be aware of your end users and their particular challenges, the better you're going to make all of these small decisions and be more effective in your job. Software development really is not, coding is a big part of it, but that's, in the grand scheme of things, probably a small part of the overall job. It's you really need to understand, what you are developing to make those effective decisions.
Right. Thank you so much, RJ. So, uh, how do you determine whether a healthcare technology is solving a real problem or simply using technology because technology is available?
That's an interesting question. You do have a lot of people over the years that want to throw technology at a problem. Technology, even in of itself, doesn't solve a lot of problems. It's so much more about the people and the processes that are put in place, and that's what makes the difference. You can create the world's best digital health solution that helps a physician or a patient improve their lives. And if it's not part of the physician's workflow, they're probably not going to use it because it's going to take more time. They don't have time to log into 5 different systems to be able to understand what's going on with the patient. So, technology is important and it's an enabler, but it's really about the people and the processes that make it effective. So you have to think about that. One of the things I talk about in my book related to this too, there's all sorts of online note-taking applications, note-taking things on your phone, on your computer, and they're definitely useful. But I still use old school paper and pencil. I get a lot of satisfaction of being able to look at that. Here's my to-do list, that I need to get done this week, that day. And then, the things that I really need to get done for the day go on a sticky note. And that helps me prioritize and very quickly at a glance see what I need to accomplish that day, that week, over the next couple of weeks. When you escalate that and you put it into, some sort of productive management note-taking application, it gets harder and harder to find the items that you need to focus on. And then it's a distractor. So if you need to figure out what you're going to do next, and that means picking up your phone to look at the next to-do item, well, you're also likely to hit that icon for TikTok and start scrolling through. And next thing you know, 10 minutes, 15 minutes go by, and there goes your productivity for the day. So yeah, I use it all the time. I love AI, but old school paper, still comes into play and is an effective strategy.
Okay, so looking ahead, what emerging technology do you believe could have the biggest impact on patients and population health?
The idea of wearable technology, think your Apple Watch, the Aura Ring. There's a number of various different rings that are on the market now to track your heart rate, your heart rate variability. They're moving into blood pressure. There are even, continuous glucose monitors on the market. These are the things that are going to make the biggest impact with the combination of the generative AI systems to understand all this data that's created. Here in the US, we have really a sick care system. When you get sick, you go to the doctor, you get treated. And if you're lucky, you get 7-10 minutes, with that physician. So much happens with our health outside of the 4 walls of that doctor's office, out of a hospital. It's how you care for yourself each and every day, how you eat, how you move, how you rest. These are the things that impact your health. They're finding, the social aspects of being more social and being around people helps elongate your life and have a better quality of living. And it is, challenging. Not everybody has access to the same level of food, but you do the best you can to eat, more whole foods, less processed foods, move more. This is one of those things when I talk about wearables and how it can make a difference. I did this experiment wearing a continuous glucose monitor. I'm fortunate I don't have diabetes, but I ate a meal and then sat down on the couch and watched my blood glucose go up and come back down. The next day, I did the same thing, but ate the same meal. But afterwards, I went for a walk, a 15-minute simple walk. And you can see in the metrics tracked by the wearable device how my blood glucose responded much better to eating that meal. So if you do have diabetes or just trying to improve your overall health and wellness, after you eat a meal, go for that 10-15 minute walk. You don't have to run around the block, just go for a walk.
Okay. Thank you so much. This has been a very wonderful episode. If technology is supposed to help us live longer and healthier lives, what should we be doing now to make sure technology remains a tool that serves patients rather than something that ultimately controls them?
That's up to us each individually, and you do have to understand that it's a tool. It's technology, and even though you can get some incredible answers out of generative AI today, recognize that it's not a true medical expert, and use it to its advantage, but follow up with your physician, a qualified medical professional, to double check what you're learning and understanding from the system. And that'll help mitigate any potential issues.
All right, RJ. So this has been so exciting so far. It was a pleasure having you on the show. I really appreciate you taking out your time to be here. So before you go, for those who would like to get your book once again, and those who would like to connect with you, how can they do that?
Yeah, thank you. This was a great conversation. I appreciate you doing this. The book is called Productive Harmony. It's available on Amazon. It's probably the easiest place to get it. And if you want to touch base with me, LinkedIn is probably really good. RJ Kedziora there, or just my work account, rkedziora at estenda.com. So love to hear from everybody.
All right, thank you so much. My audience as well. If this episode is speaking to you, make sure to share it with someone out there who might need to hear this. I love you guys so much, and I will see you guys on the next episode. Bye, guys. Thank you, RJ.
You're very welcome. Thank you.